Chapter 4. In this chapter, we're going to be covering the anatomy of the thigh and the leg. And in this PowerPoint presentation specifically, we're going to be covering the bones and then the muscles. Giving an overview of the bones of the lower appendage, we have the femur, which we covered in a previous video in Chapter 3. The patella, which is your kneecap. The tibia will be your shin. Fibula is a tiny, skinny bone just to the outside of your shin. Tarsal bones, there are 7 tarsal bones, and if you'll recall from terminology, tarsal is going to mean the ankle region. Metatarsal bones are going to be the bones in the middle of the foot, so metatarsal in between the tarsals and the phalanges, which are the toes. So working on the tibia first, we're going to go over the tibia and the fibula, and we'll look at a picture of them together. First off, the tibia, the head, is going to be the superiormost portion. It will have 2 parts to it. It'll have a lateral and medial condyle of the tibia bone. And then also there's a structure that sticks up in between them, 2 little mountains in between these 2 condyles on the superior or top of the bone, which is called the intercondylar eminence. We broke that word down, intercondylar, meaning between the condyles. Eminence is telling you it's emitting itself, so it's projecting upward. Shaft seems to be the middle of the bone. The tibial tuberosity, this is a structure you can actually feel on yourself. If you go on your shin and you slowly walk up with your fingers, you'll feel a big bump in your actual shin bone right before you get to your kneecap and the ligament underneath there. But you'll feel this big bump on the bone. That's your tibial tuberosity. We'll talk more about that later. We also have something called the medial malleolus. And what is so important about this structure is that in its name it tells you medial because it is actually also giving away the medial side of the tibia. So if you can find the medial malleolus, and then also if you can find that tibial tuberosity, we just felt that on the front of our body, so the tibial tuberosity will tell us the anterior side of the bone. Finding these 2 structures can identify right from left. The medial malleolus is also the bump you feel on the inside of your ankle that hurts pretty good whenever you hit it on something. On the fibula bone, we have the head, and the head is actually going to look like a tooth almost. And so we have teeth in our head, and that's one way you can remember that the shaft will be the middle portion. And then we have the lateral malleolus, which is going to be the sharp-ended point on the opposite side of the head. And that forms the outside of the ankle. So the other bump you feel on the outside of your ankle. So as we take a look, we're going to start with that tibia. So I'm going to zoom in just a little bit here. So looking at the head, it's going to be this portion right here. And if we look down, you can see it's a little bit different than this end. So the head's going to be the bigger end here. We see our intercondylar eminence. So there's one bump right there. There's a second bump right there. So all of that put together is going to be the intercondylar eminence. We have our 2 condyles, just named after what side they sit on, lateral and medial. And so when it comes to these condyles, what you want to do is find the structure down here. We'll come back to it. But medial malleolus, this hook, if you follow that up, that tells you the medial side of the bone. So I know this is the medial condyle here versus lateral would be the opposite side. Now also, we can see the tibial tuberosity. So that big bump right here, which is telling you that is the front of the bone. Here is the shaft, just running down the middle.